So this is the fishbone diagram that I created for this case study, and the problem statement is at the tip of the fishbone, and then that has several organizing categories where the possible reasons for the problem can be identified. And the problem statement that was derived for this case study is the increased workloads for nurses are contributing to missed nursing care, including vital sign assessments and medication administration. There are 6 factors that could have been attributed to the problem, which include safety and prevention, people, equipment, environment, management, and regulation. In those categories, there are more specific subcategories that go into greater detail on what caused the problem of not recognizing patient deterioration. The first category under safety and prevention shows that 43% of all adverse events could have been prevented with better patient care. And with better patient care, the nurses would have recognized signs of deterioration sooner and could have prevented the patient from being admitted into the ICU. The category of people shows that the nurse failed to recognize the deterioration of the patient and that the patient trusted the nurse to understand their condition, both attributed to the problem because the nurse did not recognize the signs and the patient trusted the nurse to know better about their care. Under the equipment section, it shows that the chart was not reviewed properly to identify the changes in vital signs. If the equipment were used properly, the nurse may have identified it sooner. Under the environment, it shows that there are increased workloads for nurses that have they have a lack of support from other fellow nurses. And this could have been attributed to the problem because the nurse may have had too much going on and no one was there to help her with her patients. She could have felt overwhelmed and not have adequate time with a patient to properly recognize the symptoms of deterioration. The management section shows that there was a lack of training for nurses to recognize symptoms of deterioration in patients. If the nurse does not know what to look for, then problems are going to arise. The last section of regulation shows that there is a need to enhance surveillance of adverse events to promote safety. There needs to be a better effort to increase surveillance to identify problem areas so they don't happen in the first place.